Did you know your body's health depends on a microscopic layer most people have never heard of? The GlycoCalyx? Welcome to the future of vascular health. Healthy vessels, healthy future. The podcast where we uncover the science and secrets behind optimal vascular health, longevity, and vitality. Brought to you by the GlycoCalyx Research Institute, founded by Dr. Hans Vink and Robert Long. This show delivers cutting-edge insights into microvascular health. Through solo episodes and expert interviews, we'll teach you how to protect your GlycoCalyx, improve circulation, and unlock better overall health. Tune in each week and discover how healthy vessels lead to a healthy future, because protecting your GlycoCalyx is the key to a longer, vibrant life.
All right. So, if we look at how we can measure whether you are type 2 diabetic, so these are the current guidelines. Just to let you know, there's 34 million people with diabetes. That cost about $412 billion a year to treat people with diabetes. And several ways to test whether you have diabetes. One test is to take a blood sample and look at your red blood cells, because if there's a high level of glucose in your blood circulating all the time, the glucose will stick to your red blood cells, and you can measure the glucose concentration on your red blood cells. And that's called hemoglobin A1C or A1C, and it's expressed in percentages. And if it's more than 6.5%, then that's a definition of being a diabetic. So that's because the lifespan of red blood cells is about 3-4 months. So that's your 3-4 months average of blood glucose level. So tells you it has been too high already for several months.
So your blood is basically giving them a clue of what's happening because they see it.
Yeah, your blood cells are exposed to the high glucose all the time, and it really gives you a good average level, not just one spike at one day, because red blood cells, now typically they have a lifespan. Your average age of your red blood cells is about like 100 to 120 days. So it's an average value of your blood glucose. Another way is to measure your fasting plasma glucose levels, FPG. So that's at least 8 hours after a meal. If that level is higher than 126 milligrams per deciliter or higher than 7 millimoles per liter, that's also a sign that you're diabetic. Or if you do that oral glucose tolerance test, which is a test you can do in the lab. So you take a fixed amount of glucose in a drink, and then you measure over time how high your blood glucose levels are. And if you're healthy, then after 2 hours, your blood glucose levels should be back to normal. You should be able to take all the blood glucose out of your blood and take it into your tissues. But if it's still higher than 200 milligrams per deciliter after 2 hours of the drink, or higher than 11 millimoles per liter, that's also a sign that you're diabetic.
So if a person wanted to do that test themselves, how much of a sugary drink would they need to?
Well, I don't know. Let's see. It says here it's a glucose load equivalent to 75 grams of glucose dissolved in water. So I guess you have to look. I'm not sure how much sugar there is in a can of Coke. I'm not sure. Have you one there with you, Bob?
I don't, unfortunately.
But
fortunately,
I think it's probably like, no, I don't know, 4, 5, 6 cans of Coke equivalent. It gives you a spike in your blood glucose. And if it's still higher than 200 milligrams per deciliter after 2 hours, then clearly you have a problem with taking the glucose out of your blood, put it back in your organs. Well, now we know how to measure whether you're a diabetic. And we can see the prevalence, or what percentage of people in the US have diabetes. So on the left are males and females on the right. So it ranges pretty much between 10 and 50% of the total population. So it's a little bit less in white males and black males, a little bit higher in Hispanic and Asian males. In females, the white females have the lowest prevalence of diabetes, but it goes up significantly in black females and Hispanics and also in Asians. Well, in addition to a gender effect and ethnic background effect, there's also a correlation with the social status, so related to the level of education that you got. So if you are get less than high school education, the prevalence of diabetes is much higher than the people that actually have more than just high school education, probably then related to the lifestyle and the quality of the food and level of exercise. So that's obvious in white people, also in black and Hispanic, no, not so much in Asians for some reason. Also, if you look at where in the US the prevalence of diabetes is highest, it's clear that the highest levels of diabetes, so the dark areas, the prevalence is between 12 and 20%. And then you see a similar distribution of levels of obesity, which are typically more prevalent in the South, less in the North, or I think there's a clear relationship between obesity and the development of type 2 diabetes. Well, if you compare the prevalence of diabetes now, the last few years compared to 30 years ago, like in the 1980s and 1990s, you see for both males and females, the prevalence of diabetes has more than doubled. So it's clearly a strong increase in the level of people developing type 2 diabetes. And those are the diagnosed ones that we know of. The undiagnosed ones tend to be similar, like 3% of the people in the US. If you look a little bit more detail in for all the people with diabetes, what percentage knows that they're diabetic and gets treatment, like 20% of the people with diabetes know they're diabetic, they use medication, and they are able to control their glucose levels and their insulin levels. So they're well controlled. However, almost 50% of all the people with diabetes that know they are diabetic, they are treated, but they're unable to control their glucose levels. So they're still at risk, and they could do much better if their glucose levels were better under control. There's almost 10% of people that do know they have diabetes, but they don't get treatment, so they're uncontrolled. And there's about 22% of the people with diabetes that don't even know that they have diabetes, and so obviously they're not treated also. So a big group of people that walk around have diabetes, but didn't get tested, don't know they are diabetic, and they're not using their treatment to control their glucose levels. So next week we'll talk a little bit more about the impact of diabetes on the microvascular health. So you've seen this before. So we've done some studies using the GlycoCheck system to check whether their GlycoCalyx is healthy or whether the GlycoCalyx is compromised in diabetes, and how that impacts the function of insulin in controlling the role of the microvasculature, the potential role of the microvasculature to distribute glucose, and how insulin can optimize the microvasculature and GlycoCalyx to be more effective in controlling your glucose levels, and how that might break down in people with type 2 diabetes. So with that, Bob, give the word back to you.
Well, thank you, Hans. That was a good introduction to understand type 1 and type 2. I've heard a term thrown around lately, type 3 diabetes. Are you familiar with that?
No, I'm not. No.
Okay, I just
Do
curious.
you know what they mean?
No, I just heard it recently, and I wondered, I didn't know there's a new category, type 3. So
no, maybe I have to dive in. So what I do know is that the line between type 1 and type 2 get blurry. So people that have type 2 diabetes, which they have a normal functional pancreas, just they need to produce more insulin because they're less responsive to the insulin to control their glucose levels. So then, your insulin levels go up and up and up. Your pancreas has to work harder and harder over time to keep up with the higher demand for insulin to try to control your glucose. And at some point, your pancreas will get damaged because of the high level of activity. And then, and so when the pancreas gets damaged, overworked, and at some point, its ability to produce insulin will go down. And then you have like a mixed type. So you start out as a type 2, then you will also add some type 1. So you mix type 2, type 1 diabetic when that happens.
Maybe 1 + 2 = type 3. Who knows?
No, maybe. I wouldn't be surprised, but we'll dive into that and come back to that next week.
So one other question for you, because I know we're going to dive into it deep next week with the studies that you've done. And, a lot of this is stuff that you were into when I first met you. And that's one of the things that impressed me, because I have an interest in type 2 diabetes myself. But I guess what we'll see next week is the impact of what we see with the GlycoCheck device and the measurements that we get that make up the microvascular health score, and how those are implicated with type 2 diabetes. Is that part of what we'll talk about?
Yeah, definitely. So next week we'll look at the changes in capillary density, or also your recruitment capacity. So how many reserve capillaries do you have, how that changes when glucose goes up or insulin goes up, and how that might break down when your GlycoCalyx gets compromised. So yeah, I'll go a little bit deeper into that. So, and then the microvascular health score obviously is a combination of that number of capillaries and the level of GlycoCalyx damage that you have, how that changes also in type 2 diabetes.
Okay. Well, it seems to be a correlating factor that what happens to your capillary network and what happens to the thickness of your GlycoCalyx are all related, as it affects your overall general health, regardless of the condition, is what seems to be the recurring theme here.
Yes, that's looks like that's happening. So we'll come back to that next week.
Okay, well, great, Hans. Thanks, and you have a great night, and we'll talk to you soon.
Thanks for listening to the Future of Vascular Health. Healthy vessels, healthy future. If you're ready to take charge of your health, it's time to check out Revasca. This powerful supplement is designed to protect your GlycoCalyx, the microscopic layer that keeps your blood vessels healthy and strong. Revasca can help support your heart health, improve circulation, and even reduce high blood pressure. It's also great for boosting brain function, keeping your kidneys healthy, and preventing vascular complications before they start. Think of it as a way to keep your body running smoothly so you can live longer, feel sharper, and stay active. Don't wait. Take the first step toward better health today. Visit GlycoCalyx.com to learn more about Revasca and how it can help you protect your future.